name is Chen. I'm a family practitioner in Cupertino. Been asked to give a little talk on vitamin D. I'm not a Graves disease or thyroid expert, but I think having a healthy level of vitamins and hormones can help you through your illnesses or preventing illnesses. So today I'm going to focus on the vitamin D issue. So I'm going to talk about what is vitamin D, why we need it, how to get it, do you need to supplement, and how much to take, so basic concepts. So vitamin D actually is not a true vitamin. A vitamin is a substance that you cannot produce on your own, where you need to ingest it with food or supplements. Okay, so vitamin D originally was named when this doctor figured out it can cure rickets disease, so he called it vitamin D because it was A, B, and C is already found, so he used the D. But later on we found out that it's actually a type of hormone. Like all hormones, is produced by the cholesterol. And we'll talk about how it's synthesized in our skin in a bit. So generally hormones are chemical messengers that we have throughout our body. What it does is communicates between cell and cell or an organ to another organ. So there's many hormones in our body. Thyroid is a hormone, estrogen, progesterone, testosterone, these are our hormones. Okay. We know that vitamin D has, in our human genome, there's about 2,700 receptor binding sites that's been identified with vitamin D. So it does a lot of things, it interacts with our genes quite a bit. We don't understand all the interactions yet, but it's quite important. Okay, so once vitamin D is made, either through our skin with ultraviolet B, or we ingest it with our food source, or we supplement, the pathway is that it has to get to the liver. The liver converts it to calcidiol, and that in turn goes to the kidney and gets converted to calcitriol, which is the active form of vitamin D, and that's the chemical hormone that interacts with our genome. Okay, so why we need it? So the most important part of vitamin D is that it regulates our calcium phosphate, and that's important in providing healthy bone. So when it was discovered that it would prevent rickets or cure rickets with vitamin D level. So why do we need it? There's a lot of studies on the benefits. Some of them are shown that in elderly women in nursing homes, a low vitamin D level has a higher mortality or death risk compared to a normal or optimal level of vitamin D. Prevents premature aging. At low levels of vitamin D has been associated with multiple sclerosis. It is not a treatment for multiple sclerosis, but they noticed that higher level or normal level of vitamin D has lower risk of developing multiple sclerosis. It's also been known that it can help to reduce influenza infection or viral infection in general if you have a healthy dose. Okay. This is a little busy slide here, but it basically some of the major studies that's been done on vitamin D prevention of diseases. So, and on the top, it goes from the vitamin D level and the serum level, anywhere in 6, and goes across up higher in this level. So I'll go through these. So basically, it's looking at down here is rickets disease. It is 100% preventable when your level of vitamin D is at 20. So originally, that's how the FDA decided that, or the normal level is all you need is 20 to be healthy, but really it's all it means is that you won't get rickets at 20. Okay. So all these other studies that are showing you, these are actually done by major journals. These are not the layman's journal. So all-cause cancer, when your level of vitamin D is at 40, there's a 35% reduction in all-cause cancer. And you get up to 50, it's about 60% reduction in all-cause cancer. And this is published by American Journal of Clinical Nutrition. Breast cancer reduction, there's a 50% breast cancer reduction when your vitamin D level is at 50 or higher. This is the Biochemical Molecular Biology Journal. Ovarian cancer, again, 20% reduction at 40. Colon cancer, a 50% reduction at 40. There's no other drugs that we know that can actually reduce colon cancer by 50%, prevent colon cancer by 50%. This was done in American Journal of Preventive Medicine. Non-Hodgkin's lymphoma, 30% reduction at around 40. Type 1 diabetes, onset of type 1 diabetes dropped 50% with a level of about 40. All fracture risk is reduced 50% when the level is 36 or higher. Elderly woman, 50% reduction in falls at 40. Multiple sclerosis here, 50% reduction about 40. So again, these are the major journals that published results. So how do we get vitamin D? Vitamin D, so when we get sunlight, there's ultraviolet B. It has to be on exposed skin, and through our skin, it produces vitamin D from cholesterol. So there are a lot of variable factors. So a lighter skinned person will absorb more the ultraviolet B. So if you are darker skin, if you just wear sunscreen, or you sit in a car behind a glass, or there's a lot of smog it really blocks and cuts down on the UVB. So normally UVA is one we worry about skin cancer, and that penetrates windows and sunscreens most of the time. Okay. The other way of getting vitamin D is through our food. So fatty fish like salmon, tuna, fish liver oil. An example, 3 ounces of salmon gives you about 300 international units. It's not that significant. The other way is a supplement, and the supplementation should be vitamin D3, not D2. D2 is less potent. So do you need to have supplement? And I think this is a really simple question to answer. Is that there's a very easy blood test you can get. LabCorp, Quest all provides this test. Serum 25 hydroxy vitamin D level. So this is the level that I've been talking about with the previous slides. In LabCorp and Quest, it's important to note that is nanomoles per liter. Other countries might use a different. It's a nanomilligram or something per milliliter. So, but LabCorp and Quest both uses the same. According to LabCorp and Quest, it used to be normal range used to be anywhere from 20 and higher. That's now changed around 30, 32 as a normal range, and high normal will be 140. So it's a pretty wide range of normals. Okay, so what is the optimal level? You know, I keep my level around 50 to 60. Sometimes it might go up to 80 if I'm playing more golf or something. But I think for me, that's the optimal level. And that has to do, again, going back to the major studies. Where do you want to be? Do you want to be at 20 where you're just preventing, rickets, or do you want to be up at 40 to 50 where you have 50% reduction in a lot of these disease states? Okay. So how much to take? That depends on what your serum level is and your health conditions. So health conditions are important because back in the first slide we talked about your ability to convert vitamin D into active form. It requires you to have a healthy liver and a healthy kidney. Before that, you also have to have a healthy digestive system, which I think is a major issue we have, is that there's a lot of malabsorption of substances that we ingest. So if you have Crohn's disease or any type of digestive disorder, that's going to reduce your absorption. If you have liver disease, it's going to reduce the conversion to and the kidney disease. Okay. But in my general rule is that if your level is less than 20, I recommend taking 10,000 international units per day of vitamin D3 for 2 months and then retest. If you're less than 40, you can take 5,000 once a day, and in about a month or 2 months, you can retest to see where your level is. And after you reach a steady state, you can monitor it for 4 to 6 months. So it takes a while for vitamin D levels to raise in the serum because vitamin D is fat soluble, so it takes time to build up your reserves. So if you have a lot of fat adipose cell in your body, that's going to suck up your vitamin D into that reservoir, sort of, and then your serum level will rise up after that's been fulfilled. Okay. So usually I keep the level below 100. Now I did test a 21-year-old that came in for mood imbalance or depression, and this is one of my screening tests for depression. And he was a lifeguard, so he was in the sun 5 to 8 hours a day, and his level was 124, so he's very healthy. So 100 is still a pretty safe level. Now there is definitely anything too much is not good. So talk about toxicity. So the symptoms of toxicity is pretty non-specific: nausea, anorexia, weight loss, and polyuria. And one thing is that there is potential calcification of kidney stones and tissue calcification, but that is really usually happens when you take too much calcium supplement with vitamin D. So normally now we're recommending less calcium supplement per day, so less than 1,000 milligrams per day should be adequate if you have a good vitamin D level. So the study shown that levels above 500 is potentially toxic. This thing is pretty safe, and even if it takes, I think the study showed that they were taking 40,000 international units once a day. After about 2 months, the levels went above 500. That's a lot. So what to do? Some patients come in and they go bump up a little high, 120, 140. I just tell them to stop the vitamin D supplement and monitor and retest in about a month. Now the level will take a while to drop down again because there's a reservoir of vitamin D in your fat cells, and that takes a while for it to drop down. So my clinical observations of supplementing with vitamin D with my patients and myself is that I see a reduction in upper respiratory infections, sinus infections, ear infections, particularly in the winter times when the influenza season is around. That vitamin D level can help to prevent those infections. Joint pain and bone pain, I've had significant reduction after about 2 weeks of vitamin D supplementation in some of the patient. Depression, particularly seasonal affective disorder where people are more depressed in the winter month, and I think this is probably directly related to lack of sunlight and vitamin D level. Better skin, hair, nail, may be helpful in weight loss. That's not that clear. Okay, so conclusion. I think everybody should get their vitamin D levels tested, see where you are. You can get more sun exposure to boost up your vitamin D level, or you need to supplement with oral vitamin D3. Monitor levels when you're on supplement to make sure you're in the optimal range. And I usually advise to take a little extra vitamin D3 in the winter month since there's less sun exposure.
Can you go back just 2 slides?
Sure.
So you might be saying, well, wait a minute, I don't have multiple sclerosis, I don't have colon cancer. Why are we talking about vitamin D? Vitamin D, I don't think the studies are out as effective as they should be. There should be a nice prospective study that could be a graph up there. But it's a hormone, and patients with Graves disease have all of these problems. So increased risk of sinus disease. When you have sinus problems, it makes your eyes worse. Reduced joint pain. Oftentimes there's a lot of aching, especially if you're on any sort of steroid or you're coming off a steroid. Depression, we all talk about the brain fog and just not feeling good, the anxious sort of sadness. Skin, hair, nail, all affected by the thyroid disease, wherever you are, whether you're in the high or you now are in the low or you're somewhere in between. And then the weight loss. Again, if you're being exposed to any sort of steroid form, you may have issues with, trying to get you back to your best body weight. With women in particular, you not only have your vitamin D that's often low, your thyroid's off, your estrogen's off, and you're dealing with a lot of different things which, exacerbate all these things. So I think in thyroid patients, we underutilize the vitamin D test. And I think it's super important, if your practitioner's not getting it for you, whether it's your primary care doctor, your ophthalmologist, your endocrinologist, you really should ask for it to be tested. You were saying the weekly. What do you think of these ones where it's the big 50,000 unit? When do you use that?
I don't, because I feel that because absorption is an issue, right? So if you have some digestive disorder issues, if you're taking one-time dose of high doses, your GI tract probably is not able to accommodate that larger dose to absorb that well. So by taking on a daily basis, if you have digestive disorder, it might have a better chance of getting more absorbed.
And so we know with Synthroid, you've got to take it, not with food. When do you recommend? Okay, you've got a patient with Graves disease. They're now on supplemental therapy. When do you recommend they take it? Morning, night? How does it mix with the medication they're on?
Normally, fat-soluble vitamins, I recommend taking it with food. It seems to be better absorbed.
Doesn't matter, morning or night?
No.
And how about if you're instead you're on methimazole? Say you're not yet on a, does it matter? Can you take it the time you're
I'm not sure.
How many people here are taking vitamin D? How many people have not had their vitamin D tested? Go get it. No, I mean, it's really impressive. I mean, so we're kind of trading skin cancer, which, it's real, and skin aging for significant increases in a lot of different cancers, and now we understand autoimmunity. So it's not only multiple sclerosis, but it's rheumatoid arthritis, it's thyroid eye disease, it's Graves itself. So it seems to be interfacing in a very dangerous way that nobody guessed when we all started slathering on the sunblock. Question?
I'm pretty sure it's either the T4 or the supplemental T3 medication that recommends that you break it at least 4 hours from any fatty vitamins like the D3. So if you're going to take it in the morning before you have any food, generally with the Synthroid, probably wait till the lunch meal to take the vitamin D3.
So how many people are on Synthroid or levothyroxine, and when do you take it, morning or night?
Morning. I take it in the morning without any food, and then you have to wait, I was told, at least a half an hour or an hour before you then take your other vitamins and your food. Is that so?
Is that long enough? Or do you think it needs to be the 4 hours? Because I've had a couple patients set their alarm for 4 a.m.
Wow.
There's Synthroid, I'm like, whoa, that's...
Well, yeah, I'm not sure what the pharmacology is, but I think it's important to be able to accommodate your life. I mean, if you're on medication, you kind of have to still live and not live your life around medications. You just have to do the best you can to adjust your lifestyle to medications. It's better to do that than just forget about it and not take it. Because a lot of patients are not compliant. You have to exactly do this, and they can't do it, they forget about it, or they stop it.
There's a test out there, if anyone hasn't had it, my patients all know it. I live and die by the TSI. It's a test that just helps me kind of understand where in the curve of activity you are. And I swear the patients who have low vitamin D, they just keep flying high. So it interfaces with, just like you want to be euthyroid and get your other numbers right, you want to get the vitamin D right. And so I think monitoring this along with your thyroid functions is super important.